This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. Carper's Ways of Knowing is a model that provides a framework for comprehending the forms of knowledge that nurses use in their professional jobs. In 1978, nursing theorist and educator Barbara Carper was the first person to present this concept to the nursing community. The empirical, the personal, the ethical, and the aesthetic are the four primary categories of knowledge that make up Carper's Ways of Knowing. Empirics. Empirics is the way of knowing based on scientific methods and empirical evidence. It involves collecting data through observation, experimentation, and measurement to test hypotheses and develop theories. In nursing, empirics is used to develop evidence-based practices that are supported by research. For example, the effectiveness of hand hygiene in preventing the spread of infections is an empirical finding in nursing. Personal knowledge. Personal knowledge is the way of knowing that is based on an individual's personal experiences, values, and beliefs. In nursing, personal knowledge is an important component of holistic care and includes an understanding of the patient's cultural background, values, and beliefs. For example, a nurse may use their personal knowledge of a patient's cultural customs to provide care that is sensitive to their beliefs and values. Ethics. Ethics is the way of knowing that is based on moral principles and values. In nursing, ethics involves considering the moral implications of decisions and actions related to patient care. For example, a nurse may use ethical principles to guide their decision-making when dealing with end-of-life care, informed consent, and confidentiality. The nurse must consider the patient's autonomy, dignity, and the principles of beneficence, justice, and non-maleficence when making ethical decisions in practice. Aesthetics. Aesthetics refers to a mode of knowledge that centers on emotional responses to and sensory analysis of things of aesthetic value. Aesthetics in nursing refers to the practice of making a patient's physical surroundings pleasant and helpful to recovery. The healing process and the patient's entire experience can be facilitated, for instance, by introducing aspects such as nature, color, and music into the design of the patient's room. Clinical encounter. Among my many nursing experiences, one that stands out to me most included caring for an elderly patient who was suffering from dementia. The patient was prone to straying off and becoming disoriented. The patient's inability to speak further complicated their communication issues. Understanding the patient's mental and physical requirements and exercising patience and attention were essential to providing the necessary treatment. I used Carper's Ways of Knowing to provide the patient with the best treatment I could throughout our interaction, as illustrated below. Empirical knowing. I had to observe the patient's behavior, monitor vital signs, and document any changes in their condition. This allowed me to identify any potential risks and make appropriate interventions. Personal knowing. I had to understand the patient's emotional state, and I had to reflect on my feelings towards the patient and their illness to provide holistic care. Ethical knowing. I had to consider the patient's autonomy and informed consent and ensure that the patient's rights were respected at all times. This included ensuring that the patient was not restrained without their consent. Aesthetic knowing. I had to understand the patient's experience from their perspective and create a comfortable and meaningful environment for them. This included paying attention to the patient's music and activity preferences and making sure that the patient felt seen and heard. Conclusion. In conclusion, Carper's Ways of Knowing offers a thorough grasp of nurses' many forms of knowledge in their professional work. Every form of knowledge is necessary in order to provide patients with high-quality treatment that is holistic in nature. The basis for accurate evaluations and therapies is provided by empirical knowledge. Personal knowing makes it possible to have a deeper understanding of patients, ethical knowing guarantees that patients' rights are safeguarded, and aesthetic knowing encourages healing and well-being. This essay on the 4 ways of knowing in nursing was written and submitted by a student just like you. The Ivy Panda Samples database hosts thousands of works similar to this one, on various subjects. Visit ivypanda.com to find what you are looking for, free of charge.